Well, hi, everybody. Welcome to the product call. It's another Monday night. I'll tell you, we've got a great night for you tonight. Very special guest. Anjanette Pizan is here with us tonight. And we're going to just jump right into it because her story is very unique and a pretty big deal. And we want to hear what it is that's going on with her. Anjanette, welcome to the call.
Hi.
So, Angela, going ahead and let's just start right into it. Tell us what's going on with you and what's been happening. Tell us a little bit about your story and your background.
Okay. Well, like I said, I've got quite a bit going on with my background and everything. I was one of the people who was really excited when we heard about Core and all of the sticks coming in when everything was going on with Jamberry and M and everything. And this is my first time talking about it publicly to a big group like this, but just out of high school, I was infected with HIV. And I'm a longtime survivor with HIV. Like Dr. Tippelman said earlier today, he was like, wow, that's 20 some years. And yeah, that's 20 some years. Most people that I know don't live that long. I'm considered a long-term survivor, which is a good thing. And then there's other things we've also found out along the way, not to put that on the back burner because that's a great big thing in itself. But I've always had something that's been bothering me with my gut issues. And we found out after I had Roux-en-Y, the bypass, I always forget, with all my different surgeries that I forget things sometimes too. So I haven't been able to take SMART enough yet. And I'm hoping to take that one along the way. But right now I'm solely, Core is my main one right now. And I'm really looking forward to taking the SMART later and hopefully get some of these issues taken care of as well. But one of the things that we found out once I started losing weight that they couldn't find when I was heavier is that I had a birth defect and I have chronic pancreatitis as well. And I had a lot of pain. Like in high school, I tried being on the swim team and I wanted to dive because my brother was a diver and things. And I swam a lot at home because we had a pool, but I would start doing the laps and things that I needed just to practice. And I couldn't finish. I would just hurt so bad. And they said, oh, you have IBS. They accounted everything to IBS. And I was like, there's got to be something else going on here. And it wasn't until after I had my my second round at Roux-en-Y, because the first one didn't heal correctly, that we finally found that I had this this birth defect and that I do indeed have chronic pancreatitis. So, which I pain through the roof, like I said. We've already found out that I had fibro. So I have these long list of different things. I'm polycystic, so I have PCOD, which a lot of women are familiar with who try to have babies and they can't have babies when they find out that they're polycystic, which that causes pain. I have a lot of different things that can cause pain along the way. Fibro, the polycystic, and the big one, of course, being the pancreatitis, the chronic pancreatitis. And I've been in and out of the ERs and the hospitals and things with that. And like today, I'm on a feeding tube, which I've been on now for a year on this feeding tube. And I've been on and off of a feeding tube for quite a while. And this last time that I was put on it was right after we went to Utah for the Jamberry retreat last year. And I just couldn't eat anything. I couldn't keep anything down. I couldn't keep down proteins, water. I couldn't keep anything down. And so I got put on first a nasal feeding tube and my body rejected that. And then I was put on a regular feeding tube. And the problem with that is that the area that I have it in, I keep getting these, an abscess that forms, and which is extremely painful. And then I get low fevers. And and I have to take these big antibiotic pills and things. And this kind of leads up to where I was going into Nashville. I was afraid I wasn't going to be able to go. I had just found out I was going to have another procedure to have the GJ tube changed again. I had no energy at all. I've been bedridden for pretty much the last year, along with having the tube in. And I don't get to do much. I can't drive. If it wasn't for my friend coming to pick me up once a week, I wouldn't get out of the house that much. My husband works 2 full-time jobs in order to keep us going. And he's been doing that since we were married. And that's pretty much to do way back with my diagnosis with the HIV, because with the HIV, I've never been able to work full-time. Full-time for me is 30 hours or less. So that's one of the reasons why I became a massage therapist, because I could work 15 hours and make as much money as I could that way, and still try to be a part of the family and help pay the bills and things like that, which worked until I couldn't do it anymore because I was in way too much pain and I couldn't stand upright long enough to do my job. So that's where I was before I met Dr. T.
So tell us a little bit about what happened and what it's been like since, I guess it was been, what, August, July, whenever you began taking the sticks, is that correct?
I started the sticks, yeah, probably, I think it was 2 weeks before I met Dr. T. It was at least a week before I had my GJ tube changed. And my doctor had put me on antibiotics, well, maybe about 2 weeks before that. He put me on antibiotics because we could tell that I had another, what did I say? I had another abscess going on. And which I guess they knew from the last time he had changed my GJ tube, but I didn't know that, because when you go in to have that change, they put you under and you have that stuff where you don't remember what happened. Unless they put you in twilight, which he puts me in twilight now, so I remember what's going on, because my husband didn't tell me but exactly that I had an abscess going on, so I didn't know. And when they put me on the antibiotics, I knew that I had an infection, but I didn't quite know that it was as bad as an abscess. So when he went in right before that Monday before going to Nashville that week, I knew it was bad, but I didn't know it was as bad as an abscess. And when I came out and after he did everything, and he had put me in twilight that time, which was the first time, and I was like, wow, I'm awake. I can talk to you. And he was like, oh my goodness. He said, I went in there expecting to still find stuff from the last time left over, infection and stuff. It's all gone. He said, I can't find anything. He said, I am just blown away. I don't know where your infection is. He said, I looked all over for it and it's not there, and I can't explain this. And I said, I don't know. I said, maybe I can help. I said, I told you I started this new stuff. It's called Core. It has the mungosteen plant in it. I said, I told you about this the last time I was here, or the mangosteen. I say mungosteen all the time. I don't know why, the mangosteen. I said, I told you about it the last time I was here, and I was excited about it. And this time I actually had the whole write-up on it, and I gave it to him. And I said, I guess I'm going to chalk it up to prayer and this and the antibiotics that you put me on, and we just left it at that. And he's a very, very busy person. He only had like 10 minutes. He was in, out, and that was it. And I've had one abscess since then. And normally I have one a month. So I just had one last month. And that's the first one I've had since then. So I'm very blessed for that, because they hurt a lot.
So let me ask you a few questions, Anjanette. So, all right, so a lot of things going into this, and we're talking only 3 months now. First off, how many sticks are you taking? How many core sticks are you taking per day?
When I first started, then I was only taking one, because I didn't know you were supposed to take more than one. And then Dr. T asked me to increase it to 2. And then I think a month after that, he asked me to increase it to 3.
Hmm.
So I try to take at least 3 a day. I have been sleeping a lot here lately. I talked to Dr. T about that earlier today. So sometimes I can sleep like almost a whole entire day, so I don't get my 6 in that day. So as soon as I wake up, I start drinking again. I have this by my side always, and
Yeah.
it always has core in it, and sometimes it may have soul mixed with it. Sometimes it has smart with it too, because I did get a box of smart. Every once in a while, it'll have a little bit of go in it because I need to get help getting going. But it always, always has core in it.
Wonderful. So in 3 months' time, all right. Now, again, we going into this with all kinds of stuff: pancreatitis, the fibromyalgia, the all of the other things along with that, with being HIV positive,
Mm-hmm.
and just having your whole immune system just totally depleted from all of this, and abscesses on a monthly basis. So since you began on CoreAO, and again, I realize it's only been 3 months now, and that's a lot of stuff, I mean, that's been throughout your entire
Uh-huh.
life. But in the 3 months, tell us a little bit about some of the differences. I know you mentioned the abscesses. What are some of the other differences that has made in your life since beginning this?
Okay. One of the greatest differences, I mean, well, there's 2 really huge differences, but one of the greatest for me in being able to move around and stuff is the fact that I do have a permanent pain pump in my system that delivers Dilaudid every day, a small dose of Dilaudid. And I do have a device where I can give myself a little bit more, up to like 6 times a day. I don't use that device every day. I used to be at, my pain level was an 8 every day, even with that device in. I was at no less than a 7, 8 every time I saw my doctor. Every time anybody would ask me where my pain level was, my pain level is at a 2, if that, every day now. Sometimes it is a 0.
Wow.
So that is my big difference now.
Yeah.
Which is amazing for me because I have not been that low in pain since 2012.
Mm-hmm.
So in order to be without pain and to get up and walk around, I have a bad knee, which happens to be the knee that my cat loves to lay on and sleep on every night. um, it will hurt during the night when she decides to sleep on it, but in the morning, the pain's gone. I can walk on it. I can get up. I can walk around. I'm looking at being able to drive for the first time. Winter's coming, so I will not drive while it's,
Well, there's snow and ice on the ground. Yeah.
yeah, while there's snow and ice. But as soon as spring gets here, I plan on driving again. I plan on being able to get myself around again because of the pain being gone. And I don't plan on never taking, of ever being without my core because of the fact of the pain level being down. And that's the only thing that's been changed,
Wow.
in my whole regimen, because things do get changed around, but that's the only thing that's changed. The other big thing is that my counts and things, and people with HIV and stuff know when I talk about counts, they know what I'm talking about. People who don't have to deal with it, they may not know exactly what I'm talking about. But there.
Anjanette, could I just give them a little bit of an explanation and then you talk about the
Sure.
counts? Okay.
Go ahead.
The HIV virus, it attacks the immune system, but it specifically attacks something called the helper T cell. Now, this is a regulatory cell. It's a lymphocyte, belongs to the lymphocyte group of white blood cells, and it's a regulatory helper cell that helps modulate all of the other immune responses, so that when it is destroyed, and that is what the HIV does, the count goes down so low that your immune system cannot function without the signals of the CD4 cells, and as a result, you get terrible infections And that's the reason that most people die when they have HIV, is because the CD4 count becomes so low. Now, the other count that the doctors look at each time is the viral count. So they take a sample of blood and they take a look and see how many of the HIV viruses are there each time. Because, of course, if the immune system is working better, or if the medications which are intended to help the immune system are working well, then the counts will drop. And the count for the HIV virus will go down, and the CD4 helper cell will go up. And that's the ideal situation. So now tell us about your counts, if you would.
Okay. My counts have always been pretty decent because I've been on meds. Even before I was on meds, they stayed at a decent level until when they started dropping, my doctor got me on meds right away. Him and I have always had a genuine understanding, and now I have a female doctor, that I had went on a holiday at one time off of meds, which I was off of meds for probably 3 years. And once they started dropping, then I got back on my meds. That was the only time that I was really off of them for a long period of time. It was because at the time I couldn't handle the side effects from them, but now the side effects aren't as bad as they used to be. But they're still bad. I still take every day. I take a, I always forget. It's a drug they give to cancer patients for nausea. Anedstran is the name that most people don't know for it. But anyway, I take it every day, twice a day, and it's usually an as needed drug, but I take it twice a day for nausea. Anyway, my counts have gone from the best for my CD count had been around 1,000, and it usually hangs around 700 to 800, and that's usually really good for somebody with HIV. And 800 and above is what an average person's is usually pretty good. It has been the last 2 times it's been taken since I've been taking the go, it has been around 1,300. So that has been amazing. It has totally, my husband and I, it totally rocked our world.
Wow.
when we got that. My doctor, she was totally amazed. I am in a drug study in Chicago every 6 months. And the first one came through there, and the doctor, she was like, "Are you sure you're not doing something different that you haven't told us?" And I told her, whenever we do anything new, that's even if it's just new vitamins, new nutritionals, new something, with this drug study, I'm supposed to let them know, you know, it's not a drug study. It's just a study on HIV and how it deals with women. So I'm always supposed to let them know when I do something different. And I had told them, I said, this is all I'm doing different. And then as far as the viral load, there's 3 new categories kind of that they go through now to say that you are, that you have no viral load. If somebody just says they don't have a viral load, that's good in itself. But now the best way is if you're told that it's suppressed, which means that they can't find even one little teeny tiny little nano, I don't even remember the word for what they're looking for, but mine is suppressed. So they can't find anything in mine as far as the blood is concerned. So yeah, so my counts have come back. They're just rocking right now. So I'm getting ready to have another blood test here in in the middle of December, because I'll be seeing my doctor again at the end of December.
That is incredible. That is really incredible. Well, Dr. Templeman, talk to us a little bit about what's going on. We've got a lot of things that's going on with Anjanette, a lot of things that she's been dealing with almost her entire life here, and especially with the HIV and everything else. Why are we seeing such a difference and such life-changing difference here?
Well, she has a number of conditions that are going to cause inflammation on a constant basis. And the inflammation is probably the reason that she has this constant pain, and that it has been in the past very, very high. So much so that she's got a pain pump. The fact that she is now down at about a 2 on a scale of 10 is very remarkable, and it indicates that the elements which are in the core, which are intended to suppress inflammation, apparently are helping the body to do exactly that. Now, you notice I say help the body. There is nothing in the core that is a medicine. A medicine is intended to go into the body and to interfere, ideally, in a single enzymatic reaction and really do nothing else. Now, unfortunately, most medications do have side effects, and they affect a number of different enzymatic reactions, and some of them can be pretty terrible. But in her case, the situation is such that the inflammation is down. She doesn't have to take the pain medications, and that is because the body is using the raw materials in the plants to suppress the inflammation. Now, inflammation, for everyone who's listening, you can see it in the label when it ends in itis. So hepatitis would be the inflammation of the liver. Iritis would be inflammation of the eye. You could have arthritis, which would be the inflammation of the joints. And in Anjanette's situation, she has several of those systems being affected on a regular basis by chronic illness, and her body's doing a better job. Now, she has a remarkable body to begin with, because most people who contract HIV do not survive to the period of time that she has, let alone have the quality of life and the reduction in pain and the ability to move around the way that she does. So she's blessed. And in terms of the effect on the actual HIV, there have been a couple of studies on some of the elements that are found in the core. Now, we're talking about science which supports the ingredients. We're not talking about science which will let us say that there's a cure or a treatment for any disease. That kind of science has not been done and will not be done for supplements. It's done for drugs so that they can make claims, but it isn't done for supplements. And there are several reasons for it, and I think I've spoken about some of them. But the studies that do exist indicate that at a very basic level, there is antiviral effect to these ingredients when they are used in animals with infections that have been stimulated, and also in what are called in vitro studies, which would mean when cultures from human tissue are put into a petri dish and an artificial condition which eliminates many of the other variables, so that you're looking pretty much at the effect of the ingredient and the pathogen that you're looking at in the petri dish. But there are excellent studies on some of these ingredients. And even though there may not be studies on all of them, when you are taking something that your body needs to stimulate the immune system, you're going to have a picture pretty much like Anjanette has. She's got a situation which has been much worse in the past and appears to be doing better. Why? Because she is giving the raw materials to her body, which is always trying at every level to get back to normal. And, this for me is very, very satisfying to see that someone with the kinds of diagnoses that Anjanette has doing well. I'm not surprised when I hear about people with not so many diagnoses or lesser diagnoses, in that they aren't life-threatening. When I see them do well, it is expected. As soon as you give your body what you need, it's going to fix up the small things first. But there's good evidence in people like Anjanette who have complicated diagnoses which carry people away, and they give their body what is required, and suddenly we see results which directly affect the quality of life and the morbidity associated with the conditions.
Yeah. So, Anjanette, tell me one more time, when we were talking about the numbers, what were your numbers before you started taking the CoreAO, and then what were your numbers after?
Before the core, the best that I was around 1,000. So after that, it was around 1,300. But they were staying more around 700 or 800, around there. But the best they had been was around 1,000, because they fluctuate every time. It all depends on how you're feeling at the time, if you've been sick. The numbers only reflect basically how you're doing that moment in time that they take the blood from you. Because you could be feeling great that morning and then all of a sudden come down with something, and then you have the blood work done, and it's just going to show what happens at the time that they take the blood work from you. So
but to have it almost double,
yeah,
to almost double the numbers is incredible. That is really incredible.
Yeah,
and the quality of life that you're experiencing now, I mean, you're getting ready to start driving, to start having independence. How long has it been since you've had that kind of independence?
It's been a long time. I mean, I've gone now from not being able to even cook to, I have been, which my husband appreciates, I've been making dinner at least once a week. And that's in a crock pot. So I'm going to try to stand at the stove and make soup this week. So that'll be a first to actually stand to do the whole thing. My friend helped me this last week because I didn't have it in me to cut everything to put in the crock pot. So she helped me with cutting stuff and putting it in there, because this last week was a little bit of a not as good week for me. But I can feel those weeks. I call those my HIV weeks, because I could tell when it gets cold out. I always have like a week or two that I call like my HIV day, or days, or weeks when my body just needs time to rest and heal. Mm-hmm. When I was working a lot, I would call it my HIV day, where I just needed to take and rest. Mm-hmm. And my husband knew what it was, and he'd be like, okay, take the day, do what you need to. I pretty much can know what my body needs. I can feel it. That's why when I call my doctor and say, okay, I feel like this, I think I need this, he tends to listen to me, because he knows that I know how my body is doing, and I know my body.
Right.
For me, one of the main things that's happening right now that I'm really thrilled about is I'm starting to be able to eat, and I'm starting to keep proteins down. So my doctor, who I deal with my G-tube, we're talking about taking it out and starting the progress of moving it down to a smaller tube each time, so that the hole will start to heal up naturally every time. But we had just gotten a whole bunch of protein in, so as soon as we use up the protein that had come in, because it's expensive, as soon as we use that up, we're going to start the process of healing up the hole, because we have a problem with that hole and it wanting to heal. So we're going to go down to a smaller and a smaller and a smaller size tube until it heals up, because I'm starting to be able to actually eat things on my own. And that I could not do before the core. So
that's exciting news. So, Anjanette, thank you so much for being on the call tonight. This has been so inspirational to hear the changes that's going on. Dr. Templeman, anything else here as we wrap up the call that you want to add or ask here?
Well, when we listen to stories about the core, they go from the one end of the spectrum all the way across to the other end of the spectrum. And I would say that there has been only one other patient, and he was perhaps the first one that we talked to quite a long time ago, who had the scoliosis. Do you remember him?
Yeah.
And he works in Utah here at a campground, and his life has been turned around, and Anjanette's life has been turned around. And thousands of other people with lesser problems have found relief that is measurable. So am I glad that I'm in the business of sort of encouraging people to use supplements in addition to everything else that medicine and good common sense would dictate? Absolutely. I feel satisfied. And it's stories like Anjanette's that really make me feel good about what I do.
Absolutely, absolutely. And Jeanette, anything else you want to say before we tell everyone goodbye?
Just spread the word. I mean, I'm trying to tell everybody that I know about Core, and it's a complete blessing to my life. And the more people I can bless with it, I mean, I just can't tell you how blessed I feel. So,
absolutely, absolutely. You know, there's so many people that they sit and they'll have this in their hand and they think, you know, yes, I know it's good. I've heard some things about it being good, and I'm enjoying the benefits of it myself, but I'm afraid to tell someone because what if they think I'm just trying to make money off of? What if they think I'm just trying to build a business with it? Folks, we have something that is life-changing. And you've heard tonight about someone's life that is totally life-changing here. People that, you know, that are suffering, do you think they are concerned about that? They want the results. People want the results, and we have it in a product that is very, very low price, especially for what we have, very high quality, that is priced to compete and to appeal to the masses in a low cost that is getting such life-changing results. You need to tell people about it. Make sure that they know, make sure that they can get some of this because you're going to be helping people. If nothing else, this is, whether this is your ministry, whether this is your heart, your passion of what it is you do to help other people. You have the tools, you have the sticks, the CoreAO, it's got the mangosteen in it, and there just is nothing else that can compare. And we have in the CoreAO the strongest and the most productive potential, the what's the word, Dr. Temple, that I'm trying to say here?
There's just no better product out there.
Absolutely.
In the whole of the supplement market.
There's nothing else out there that can compare.
No.
So make sure that you're spreading the word. And again, Anjanette, thank you so much. Dr. Templeman, thank you to you. Everybody, we'll talk to you all next week. And you have a great night.